Tonight, a problem solvers investigation. Melissa Hippolyte looks into complaints from essential workers across Central Virginia who say they're being asked to do important work in unsafe work conditions.
Okay, so here in my car, along with some personal items, I have protective items.
As everyone stocks up on cleaning supplies.
Of course, this is the liquid gold that nobody can hardly find, so I use it very sparingly.
During the COVID-19 crisis,
Hand sanitizer in there as well with some gloves.
Olivia Blevins keeps her own stash in her trunk.
Basically, those are my supplies for right now.
She hears her governor's request to stay home. But Olivia cannot stay home. She's a nurse who goes into people's homes to provide care, and she's scared.
Feel that we are facing a higher risk than some of the other nurses that work in facilities and hospitals.
Olivia says she asked her employer about N95 masks, and they told her they are working to get them for employees soon.
We are just basically thrown to the wolves. Nobody addresses the danger that we put ourselves in to provide care for those that are at home.
And she says keeping 6 feet of distance between her and a patient is impossible.
How can you keep 6 feet if you're dealing with a total care person that you have to do their bath, change their trachs, and whatever they need, suctioning?
Olivia is one of many who have reached out to CBS 6 who say their jobs are essential, yet they don't feel their employers are protecting them from the virus.
You know, that fine line of doing your job and keeping safe and, not getting fired is a fine line to tread.
This man, who asked that we conceal his identity, works at the Fariva plant in eastern Henrico.
I think everybody's kind of on edge, Like I said, I don't see any real steps being taken, and the people working there realize it's just business as usual.
He shared these pictures with us from the cafeteria there. They show employees sitting in close proximity to each other and signs suggesting 3 feet of distance, 3 feet less than Governor Ralph Northam's request for 6 feet of distance.
I at least want to feel safe that the company's doing what's best for us as their employees, the bottom line fighters.
The head of HR at the Henrico plant declined an on-camera interview request, but did tell me the company has taken a lot of precautions to take care of its employees. For one, he said they changed the way they do breaks to reduce the number of people taking breaks at one time. He also said for breaks and lunches, they're using signage to urge folks to respect social spacing. And he said they're now checking all employees' temperatures when they arrive at work. But this employee says it's not enough and started too late.
It's scary, and every day you kind of come home wondering if you should be around your family. I wish they would be doing more to protect us.
To that point, just today, a few days after our phone call to Fariva, the employee tells us they did make the cafeteria safer for employees. But employees at other companies say that's not the case. Here's a picture shared by a worker at another factory showing workers standing close as they punch the clock. So what can they do? The governor says to speak to your manager first if you don't feel safe. If that doesn't work, the state then suggests contacting the state's Occupational Safety and Health Administration office, which told me they are fielding a large number of calls from the public on this issue.
So then you can make a complaint, and we're taking every complaint very, very seriously and following up with the businesses.
Still, it remains unclear how much OSHA will be able to do to enforce COVID-19 safety.
So we're waiting for standards to come down to the state, and then our Department of Labor and Industry are going to accept those standards. And then when we have those standards in place around COVID-19, that's when we can actually take a little bit more action.
It's like that we're put in a position to do a job, but your job could also be a life or death situation, not only for the patient, but for you as well.
We received a lot of questions from folks wondering, could they be fired if they didn't show up for work because they didn't feel safe? So we posed their question to the Attorney General's office. A spokesperson there told us there are some state and federal laws that could offer protections, but she said the easiest way to avoid that is for employers to do the right thing. She said no one should fire an employee because they are sick or afraid to come to work. Working for you in Richmond, I'm Melissa Hippolyte for CBS 6.